Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. This is Caroline, and I'm a family nurse practitioner here at Fiat Integrative Health in Franklin, Tennessee. Today, I am joined with Maddie, who has a new last name since the last time you were on the podcast.
I do. I am married now.
Crazy.
It's been a while since I've been on the podcast, too.
Know. It's like you had like a wedding and a honeymoon and a move to Ohio and all the things.
Yep. Almost like life has been so busy, but all amazing things. So.
All good things. Okay, so tell us, I'd love a little life update for all of our patients here. I think a lot of people know that you've moved to remote, but tell us kind of what you're doing and how that's working.
Yeah. So I have moved really all onto the women's health side of the practice, which is where, my biggest passions lie, and I'm loving it. I love connecting with my patients still, via video call, sometimes phone call. So that's been a fun adjustment and it's been great. I also find that there are a lot of benefits that I've enjoyed being virtual and seeing glimpses into patients' lives that I didn't see before, which is really fun, and patients being, comfortable and vulnerable in their own space. So it's been wonderful, and I'm grateful that I've been able to continue what I do.
And you also gained a few licenses, I think?
I did. So I'm currently licensed now in Tennessee, Ohio, Virginia, Missouri. I'm about to be licensed in Maryland and DC and probably others, but those are the ones that come to mind right now.
Currently on the horizon. Yeah. And I don't know I know we've updated our website some, but maybe not fully, so that people know that, we're kind of expanding our women's health in the sense of being able to see patients in other states virtually and do some work. And Amanda obviously has her Missouri license, and I think she's working on her Florida license and all things. So I know we got a call last week from someone from California who's like, "Can I see one of your women's health providers?" And I'm like, "Oh, not yet."
Yeah, maybe soon.
Maybe soon. We'll see. But yeah, if you have anybody in any of those states interested in our women's health services, then Maddie would be happy to see them.
Absolutely.
Yeah. Okay. So I'm super excited for this podcast because I've been taking on some more adult patients here in the clinic, and the use of low dose naltrexone has come up a lot more than I anticipated. I don't use it a ton in kids. I think I've only prescribed it maybe once in kids, and I don't think they ever ended up using it. Just totally understandable. But I know it comes up a lot in our women's health population and is used as a really great tool. And so we wanted to do a podcast on low dose naltrexone so that we could kind of deep dive into it, give patients a better idea of exactly what it is and why we like to use it, because it's not something that I think most people prescribe, like most GYNs, OBs, even PCPs know a lot about low dose naltrexone. So I'm excited to dive in.
Yeah, definitely. And it's something that I think is gaining popularity, I guess. More people, even more patients and providers are becoming more aware of it and different purposes. And so patients have lots of questions. So we felt that, this was a good place to talk about it, what it is, purposes that it's used for, and be a resource for patients, providers.
Yeah, absolutely. Okay, let's get started. So low dose naltrexone, I feel like I say that, or we will call it LDN, that's what we call it in the clinic, tell me exactly, what the heck is LDN?
So low dose naltrexone insinuates that there is a high dose naltrexone. So naltrexone itself has been around, I think it was FDA approved in the 1980s to treat addiction. So opioid addiction, alcohol dependence. And so naltrexone itself is typically prescribed at doses of like 50 milligrams or higher. Now, more recently, it's been studied and it's been used now between doses of like 1 milligram to 4.5 milligrams and considered to be low dose. And research has found that when you use this medication at lower doses, it acts differently in the body. And so when I tell patients this, they're like, why are you prescribing me a medication for
addiction,
opioid dependence and addiction when I just want to treat, my Crohn's disease or something like that? But research has found that doses at 0.5 to 4.5 milligrams or low dose LDN acts differently, like I mentioned. So instead of whereas the high dose or like the normal dose of naltrexone has a like more longer term effect on the body where it blocks your opioid receptors for a longer period of time, so that if someone took, an opioid medication or they had a lot of alcohol, it wouldn't have effects on those receptors because they were blocked by this medication, naltrexone. Now, at lower doses, the naltrexone only binds to those receptors for a few hours, like very temporarily. And because it binds to them temporarily, it starts essentially this blockade process. And so that process has really positive effects on the body, all over the body, because you have these receptors all over the body, from, your brain to your immune system. So you have these very anti-inflammatory effects that happen because when that naltrexone is bound to the opioid receptors, the body releases more hormones and peptides like endorphins and enkephalins, which decrease pain. They help to regulate your mood. They improve your immune system and are just generally very anti-inflammatory to individuals. And so in that way, they can have a positive effect on lots of different, chronic illnesses and autoimmune issues. So it's being very widely discussed and used.
Mm-hmm. Yeah. And so it's kind of like not coming in and like suppressing anything, even though it's blocking something. It's not suppressing your immune system, but more so recalibrating it or saying like signaling to the body like, hey, you need to make some more of these things that you really should be making. And so I think that we see it a lot, and we'll talk about all the uses, but that's why it typically comes to mind for me with like autoimmune, where it's like my immune system isn't responding in the way it should already. How can we help it do what it's actually supposed to be doing? Or like, how can we, like you explained, it's not the same. Because I think patients will go on and Google and it's like, oh my gosh, naltrexone. Yeah, it's all these terrible things.
Right.
I'm not an addict.
Right, exactly. What's my insurance going to think?
Yeah. But it's like a very short block causes this effect, I think is the biggest takeaway there. And then that causes your body to say kind of like, oh, I need to make some more of these good things in my body.
Right, exactly. And just like you said, so as opposed to taking, steroids or something that's going to suppress the immune system, these things that are released, these hormones, these peptides that are released, instead help to better modulate your immune system and almost kind of, I don't want to say reset, but like it does have those really positive benefits throughout the entire body, which then are, anti-inflammatory without telling the immune system to completely not do its job.
Right. We're not like just shutting off the immune system. We're trying to help it do what it's supposed to do in the right way. Okay, so where has it been seen both in the literature and in the clinic that we found that using LDN is helpful?
Well, in my thought process with a patient, as far as, when I'm seeing a patient and when I'm thinking through, would this be an appropriate modality for this patient? I really, in my mind, low dose naltrexone and inflammation, chronic inflammation are so linked. So if there's really anything which I think that chronic inflammation is a root, this will be appropriate, really. And so a lot of that is like autoimmune diseases. So, or really any inflammatory conditions. So multiple sclerosis or MS, Hashimoto's thyroiditis. Now, I've seen thyroid antibodies decrease with the use of low-dose naltrexone. Rheumatoid arthritis, lupus, psoriasis, even eczema, all obviously very inflammatory conditions that will flare, really helps to decrease instances of flaring, episodes of flaring, even GI related illnesses. So like inflammatory bowel disease, like Crohn's disease, ulcerative colitis. There were even some studies that showed concerning inflammatory bowel disease that there is some improvement at the layer of the mucosa, like in the gut, in patients who were on low-dose naltrexone, which is very interesting.
Very interesting.
Yeah, but not only autoimmune, definitely also like chronic pain syndromes, which do overlap with autoimmune, like fibromyalgia, even disorders that are and diagnoses that are less understood, like chronic fatigue syndrome or even like long COVID. It's been used in that, studied in that. And what I'm most passionate about in the fertility world, it's definitely being used more and more. They're talking about it at different presentations and different, big groups in the fertility world are doing more research on it, talking about it.
And seeing success with it.
Oh, yeah. And seeing success with it. That's the most important thing. So a few things that it's being used for just to improve infertility in general, for PMS, especially PMS symptoms that last, 4 or more days that are really significant and impactful on day-to-day life. Endometriosis, PCOS, which both are, have a very big inflammation component to them, painful periods, brown bleeding. So lots in that.
I know it is kind of a catch-all in a lot of the studies that are done. It's kind of like it's beneficial everywhere.
Right. Like, are you a human? This might be for you.
I know I have a patient who's on it for psoriasis and has seen some good improvement. And, when I'm thinking about using a drug like this, that's off-label use, that's not super well studied. It's nice to always go in and find like some case studies you can usually find published. So like found a really great case study on psoriasis and using LDN and, complete resolution of all plaques after 6 months. And
amazing.
This patient's seen a lot of improvement after doing like everything under the sun, to try and improve it. And that's usually what it is. It's not, sometimes LDN is the first thing you reach for, but a lot of times it's like, maybe we've tried some other things, you've done diet, you've done lifestyle, you've done some supplements, like, and we're still in the same place. Migraines is another one that I've recently started using it with. And again, there's some case studies out there or in some low or just like small studies where they have like 15 participants or something that show really good effectiveness with chronic migraines. And it's like, I know, you and I both know someone who suffers from chronic migraines and they're getting multiple migraines a week is like completely debilitating. And there aren't a lot of options out there for treatment.
Right.
So LDN, I think, is a really, really great tool for that when you're in that place of like, okay, we've gone down this road a little bit and it might be time to start this or at least trial it. And usually patients are like, yes.
Yeah, right. Absolutely. And that doesn't mean that it's necessarily like a cure-all, fix-all, but it doesn't mean that we can't still pursue the root of what might be causing inflammation.
Absolutely.
Like we can absolutely still be doing that while we're helping to get you some relief. Meanwhile, benefiting your immune system and whatnot. So it's just a really great adjunct treatment to a treatment plan.
Yes.
For a lot of patients. Even, I forgot to touch on this too, but like neurological and mood disorders too. So in the mental health world, it's being used for PTSD. It's been used for anxiety and depression because you're getting that boost of endorphins, which of course is going to benefit the brain, benefit your mood, and reduce neuroinflammation, inflammation in the brain. So a lot of wonderful effects.
Yeah, absolutely. Okay, so let's talk a little bit about like dosing, side effects, because it's not like here's your prescription and we're done kind of thing,
Yeah.
kind of drug. And it does have side effects, as anything. I like to say, even the coffee you drank this morning has side effects. Everything has side effects, whatever you put in your body. And so this one is not something that doesn't have side effects. So let's explain a little bit about, okay, we've talked with the patient. We've decided we're going to put them on low dose naltrexone. What next?
So, well, first off, we typically go through a compounding pharmacy because the dosages that we are prescribing, at low dose aren't commercially available from your standard pharmacy.
I wonder if they will start soon.
That's a great question.
I don't know. Just a curious thought.
Yeah. Who knows?
Please. Walgreens.
Stay tuned. But typically, so like I said earlier in the podcast, low dose refers to, typically 1 milligram to 4.5 milligrams. And we do titrate up. So we'll start a patient at 1 milligram and then, kind of slowly work your way up over the course of a few weeks, typically. Now, we don't necessarily have to go all the way up to 4.5 milligrams. If a patient is seeing a lot of benefit, at 3 milligrams, say, then we can hang out there and enjoy those benefits. But one of the reasons that we do start low and go slowly is to help offset or mitigate some of the potential side effects. And the biggest side effects of which being sleep disturbances. So difficulty sleeping or like very vivid dreams. So some patients have really vivid dreams with melatonin or Benadryl. So not unlike that. And it doesn't necessarily mean you have to stop the medication. It's, person to person, what they think is tolerable or not. Can also play around with morning dosing. So typically it's prescribed to take before bedtime. But if someone does have sleep disturbances with it, you can try taking it in the morning instead. Or I believe you mentioned maybe there was even a way to potentially dose it twice daily. Depending.
The half-life, or it's active about 4-ish hours in terms of it's like blocking the opioid receptors, like an hour to 4 hours. But it can kind of actively work within your body for about 12 to 14 hours. So I think especially people who are super sensitive, which a lot of people that are on naltrexone tend to be sensitive to medications, it can be helpful, or just like you said, playing around with if I do it in the morning, maybe enough of it has worn off by the evening time that I'm not getting those vivid dreams. And then I think the same for GI symptoms. So the cramping, diarrhea, sometimes. So
some nausea. Those are definitely less common in the research, but still, or headaches. I mean, ideally, if you're using it to treat headaches, you're not getting headaches, but it is everyone's different.
But it's like if you take it at night, a lot of times the nausea, you're not noticing it because you're asleep.
Yeah, exactly.
And then, you can, because it's pretty short acting, there's some studies in literature, again, small, but that show that 2-day dose or twice a day dosing. So 4.5 milligrams at night and 0.5 milligram in the morning, something like that can help with your symptoms as well.
Because you're not going a period of time without it. Yeah. That makes sense. But generally, it really is very well tolerated. And I can tell you anecdotally, it's far and few between that I've had a patient who really didn't like it or, had a side effect where they
couldn't tolerate it at all.
Yes, exactly.
I think sometimes people reach that 3 milligrams or, a certain dosage, and they're if they try and bump up,
yeah, maybe not. We'll go back down.
Or not. Yeah. And so they'll just stay at that 3 milligram or 2 milligram or whatever. Just obviously totally reasonable. Another side note is you can't take it when you're taking opioids.
Right. Because your opioids that you would be taking aren't going to have their effect. So for a patient, for example, who has a surgery coming up, it would be a good idea to kind of discuss ahead of time, planning on discontinuing the low dose naltrexone so that, if they needed opioids for pain management for their surgery or something like that, they would be able to take those medications as prescribed and have the actual benefit of pain management from their medications that they would be prescribed.
Mm-hmm. So one question that I know we both get asked a lot is like, so like if I start this, am I going to be on this for like the rest of my life?
Mm-hmm. Yeah. And we get that about like every medication, really. And as far as like long-term safety data, as we mentioned in the beginning, so naltrexone's been around for quite a long time. So they do have data when it comes to long-term use because it typically, as far as the regular, higher dosing, it is used long-term or longer term. And the safety data really does support that it can be used long-term. I mean, of course, with like many things, medications, most medications, a lot of medications are processed through the liver. So you always want to make sure that, liver function is remaining fine. You can do that through labs. So that is kind of the data that is out there when it comes to naltrexone in its normal, original, higher dosage. Because the low dose naltrexone hasn't been as widely used or definitely not used in the long term, like it's more of a newer discovery and modality, you don't have necessarily that piece of long-term data, but we can kind of extrapolate from the 50 and plus milligram dosage of naltrexone that can be used long-term. If you want to be on low dose naltrexone long-term, like we are comfortable prescribing that, we'll, draw labs like we do with any primary care or women's health patient to make sure that everything looks good. Your body's, processing it. Nothing's causing too much stress on your liver. But that also doesn't mean that, just because you start on this medication, it doesn't mean that you have to be on it forever, right? So if you wanted to come off of it at any point in time, you could. And it's not like you have done yourself a disservice because you've been on it for however long.
Yeah, absolutely. Awesome. Anything else? Any other tidbits that would be helpful about low dose naltrexone, you think?
Not necessarily. I think we covered lots of things. I guess a good resource, there is a website. I want to say it is like the Low Dose Naltrexone Trust or something that is kind of potentially a good resource for just general information or general information if you want to learn more.
Yeah. It's ldnresearchtrust.org. And so they go through kind of like the latest and greatest research about LDN. They've got a books, it looks like, all about LDN and case studies. The most, from what I've gathered in general, it's most well studied in like fibromyalgia and pain management, which makes sense because it's like an opioid blocker. Right. But yeah, if you want to deep dive a little bit more, then I'd say that website is really helpful. We send that to patients a lot too, of just like, hey, check this out. If you're kind of on the fence about whether or not you want to start LDN. But overall, I mean, it's exciting to be able to see, in patients who really have, especially in the ones that kind of have exhausted other avenues and are still, having, whether it's fertility issues, pain, psoriasis, like being able to give them some relief where otherwise your hands are tied of just like, we've kind of tried everything, has been really rewarding to see for patients. So if you're interested, obviously reach out to us. Happy to talk through it to decide if you're a good candidate for it. And then we do like to do like relatively close follow-up with our patients when we start it. I usually do like a 3 to 4 week follow-up once you're on it, just to see how everything's going. But like you said, in general, it's pretty well tolerated.
Yeah, definitely. And it's definitely gaining, more popularity and people are becoming more aware of it, both in like the functional or more holistic world and in conventional medicine.
Yeah, absolutely. Well, awesome. Well, thanks for joining me today, Maddie. I think this was super helpful and great. I hope it's helpful to a lot of our patients, especially as we navigate, helping patients discern what's going to be the next best step for them in their health journey. I hope this brings some clarity for them.
Agree. Thanks,
All
Caroline.
Right. Until next time. Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.